Hi, John Sheppard, Virginia Eye Consultants, Norfolk, Virginia. There's a tremendous amount of pressure on us these days to be efficient, to see as many patients as possible and do as good a job as possible. We have decreased reimbursements. We have increased regulation and a great deal of difficulty finding good employees. So how can I make that visit with this patient in front of me right now today the most meaningful? And still do it in about 10 minutes because I need to see 60 patients a day. 1, education. 2, bringing in physician extenders, those folks who work alongside me every day, who see the patient before I do and while I am seeing the patient and follow up afterwards. And 3, a friendly Ritz-Carlton environment to make my patients feel comfortable. So they're receptive, remembering that patients probably remember only 10% of what they hear. So we need to repeat the most important points. So my patients who have dry eye, macular degeneration, cataracts, glaucoma, requiring surgery or chronic therapy need to hear about their condition before they see me. So online on our website is available, and we have counselors who sit down and spend time with our surgical patients before they see the doctor to make that ultimate decision. That database, that education base, the 3D simulators for presbyopia and distant vision are very, very important to our patients. And then when they see me, we can make a decision together. We focus on one problem at a time. Don't make it too complicated. Tell the patient that you understand their needs and offer them a solution and a decision-making process together. Do they want a multifocal or an extended depth of focus lens? Do they want a laser or drops for their glaucoma? Do they need to see the retinal doctor for their posterior segment disease? And do they need chronic lifetime therapy for their ocular surface condition? Let's make that decision one diagnosis at a time. Repeat to the patient the problem and your recommendation for a solution and have them collaborate with that decision. This will make your brief 10-minute visit meaningful, lasting, and produce that bond between the physician and the patient with a minimum amount of time. What I learned from our consultant is the patient doesn't value your visit based upon the amount of time you spend with them. It's about how much time you spend interacting with them in a meaningful way. Let's make that visit meaningful, educational, and decisive.